Today, in this video, you're going to learn all about how you can change the way you interact with other people for the better. This is going to be transformative. This is a technique that I learned from you many years ago called Perceptual Positions, and it is awesome. Why is it awesome, Mike?
It's awesome because it's very, very simple, but the results are startling, and it will give you insights into other people you've never had and help you fix stuff in your life. So let's get started.
I totally love that description. It gives you insights into situations that you haven't thought about because we're changing the perceptual. Literally, we're going to go through these perceptual positions and you're going to notice things you never noticed before, and it's going to change how things are coded in your brain. It's going to change your behavior. It's going to change. When you change your behavior, other people's behaviors will also change because it's this closed psychodynamic loop, and it's going to be freaking awesome.
Exactly.
All right. So let's maybe start with what the heck is a position.
Let's start with that.
Right.
There are three perceptual positions, three different ways of perceiving the world around us.
Right.
Remember, it's perception, it's not reality. And the three are ways of viewing ourselves and other people as well, and they will change the way you view reality instantly. Mm-hmm. So the first one...
Oh, wait. They're really complicated names, right? First position, second position, and... third position.
Yeah,
okay, so what's the first one?
The first one is first position, and this is I, or me. This is when you're fully inside yourself in your perception. You're viewing the world from you're this person who's going through life and experiencing things. Now, all of these positions are useful for us, but people can tend to get stuck in certain positions. If someone is stuck in the I position, this is egotism.
Yeah.
That's where you get narcissism.
We need to be able to shift around. Would you say it's true most people spend most of their time in first position? You don't need to be spending a ton of time in the other positions. You just need to be aware of them and be able to jump into them.
You've got to be able to jump in.
We tend to live in our own lives and spend a lot of time in first position.
No, a lot of people spend it in third.
Yes,
so we got to be careful with that.
Good point. Okay, we'll get to that.
We'll get to that. But if you're in first position all the time, everything is I, you'll know because people say I all the time.
So selfish people would probably be in one.
Narcissistic. You know, you'll be talking about, oh, my mother's in the hospital. You know, she's so ill. And the other person says, well, I was in the hospital. And they start telling their story about how they sprained their ankle.
Yeah.
That is someone who's stuck in position
Or
one.
the person who doesn't listen very well and is just sitting there waiting to interrupt. And
like
take
you
away.
are.
Oh, yeah, there we are. I'm just kidding.
So again, all of these positions are useful. You just don't want to get stuck in any one.
All right. So
really
position one, self, I.
Okay. And when we're in that position, we feel all our own emotions in full power. So remember, you want to feel emotions, be in I. Now, the second position is interesting. This is the one where we talk about empathy, the other person, and feeling someone else's emotion. Now, not sympathizing with them, but actually feeling what they're feeling. And the way we do that is to sort of internally be inside that person's point of view. And that's going in a second.
And we call it you, right?
That's you.
So literally, if you were to literally imagine being in someone else's shoes, we have that metaphor that people hear all the time. Oh, if you just step into my shoes, you'll know how I feel, right?
And you mentally do that. You step into their shoes, into their skin, and feel the world from their position. And that's where we're saying things. To say somebody has had a horrible loss, and we're feeling their loss with them. An empath is someone who can do that, who can feel the other person's emotions.
And I like how
bridge.
You pointed out to me that is not the same as sympathy. It's a different thing. Empathy is feeling what the other person feels, as opposed to sympathy would be still first position. I am feeling, oh, I'm sorry for you, or I feel really happy for you. I guess that wouldn't really be sympathy. Well, it could be.
It could be.
Yeah.
So that's the second one. If you're stuck in second position, empathy, guess what? You'll be a doormat because everything will be seen from other people's perception. You'll just always think of them first, no matter what. And some people are like that. It can seem very nice, sort of Mother Teresa-ish, always the other person, the other person, the other person. But it can stop people standing up for their rights. It can stop people living their own life if everything is done through the eyes of someone else.
And this will culminate with a really cool activity that we won't be able to demonstrate it here, but we'll teach it to you.
We'll walk you through it. It's easy.
And so now we got to get on to third position.
Yes, and third position is them.
Yeah, this is the...
Dissociate.
You can think of this as the fly on the wall position or the observer position.
Observer's perfect.
Yeah, you're watching something else happen.
As though it's on a TV screen. Because you're not feeling any real emotions for these other people. You're neither sympathetic or empathetic, feeling what they're feeling, and you're not in your big I position. Well, I'm in charge. No, you're just observing with no emotion. It's just data. And you're seeing this
Right.
external stuff happening. No, let's just look at this. Let's say if we had 3 people in a room.
Right.
If you're in yourself, that's I. If you're sympathizing with the other person, but then one person's watching the 2 of us interact, they're in third.
So in a way, if I think of position 1, I am associated into me.
Yes.
If I'm in position 2, I'm imagining that I'm associated into you.
Yes.
And if I'm in position 3, I'm dissociated from the us, and I'm watching them.
That's right. And dissociation takes the emotions out right away. So flexibility is the key. I said you don't want to be a narcissist. You don't want to be a doormat to someone else. And if you're stuck in position 3, guess what? These are people who can be on the spectrum and not have any real emotional feelings at all.
Is this where things like dissociative identity disorder come in, or so-called?
Sort of, yeah.
But you flatline your life by not having much emotion because everything's just over there. You're not associated into any experience. You're just sort of on the outskirts.
Yes, I worked with a man who had depersonalization syndrome.
That's
I had to look it up.
And
basically you're saying you're dissociated from your own life.
Yeah.
You're just seeing everything flatline, as he said, with no emotion. That's not a good place to be.
Okay, so how do we use this?
How do we use these? Well, we say learn to use third position. When you have pain, when you have anxiety or stress, learn to dissociate from it and see it from the outside. Step outside yourself. Imagine yourself in the picture going through this, but you're not in it anymore. Increase the distance, and it'll be very hard to feel the negative emotions. A case when I did this myself was I went through a phase when I had some really bad flights, like a lot of turbulence. I was flying 50 times a year at one point. And got so stressed out by turbulence, I'd feel out of control. And of course was because I wasn't flying the plane.
Yeah.
When I hit turbulence, I instantly would dissociate. I figured out how to do this. So I just imagine, not astral projection, just
imagining rising up.
Yeah, rising out of my seat, floating up. So I'm above the plane.
Watching the plane just sort of jostling around.
And I can see myself inside just bouncing out. And I'm fine because I'm up here. It's amazing how powerful this is. Or somewhere like, if I had an epic dental procedure, and I've had many of those being British with British teeth, guess what would happen? It would get, grueling sometimes. There wouldn't be quite enough anesthetic. It would go on, and the suction thing in the water and the gagging and all the horror that goes with it. You don't got perfect teeth.
Now,
dissociate up to the ceiling of the room, looking at myself down in the chair. That's third position.
This, by the way, you can use this when you're in an interaction that you want to flatline, like to imagine just stepping out of that interaction with another person, because we said in the intro we're going to talk about how to shift how you're interacting with other people. This is just a little side benefit, right? You can use this in a situation like turbulence, like dentistry, where something's uncomfortable, but there's no one else really involved. But you can do it when other people are involved too. Using second position will also really help you in interactions.
Yes, and you'll see that with a doctor who has really good empathy, has a good bedside manner. I had a pulmonary specialist, Dr. Fraser. To this day, I thank God for this man. When I went through life-threatening pneumonia, he was my pulmonary specialist, looked after my lungs. And this guy had the best bedside manner of any doctor I've ever seen. He just had a way of getting into my head, knowing how I was feeling, and presenting how everything was going to be fine.
Right.
So second position is really handy for caregivers as well.
Okay, awesome.
Now, let's say, let's just talk about 3 again, position 3 for one more thing. Let's say criticism shreds you. You cannot stand
this is a great one.
As soon as I start getting criticized by anybody, what I do instantly is dissociate.
Might happen.
I go to third position and watch the 2 of us interacting in my mind. Instantly, the emotions disappear. And I get data. I can evaluate what he's saying and look for the truth in it and find out how to respond to him.
It's actually kind of a superpower of Mike's, because I can be critical at times, let's just say. And he is this amazing, I'm just tearing a strip off of Mike for something. And he goes, I don't care. It's just information.
It's just
information.
Yeah, because I go right into third. You can do this and make it happen.
Yeah.
Now,
I appreciate that.
That's not touching me. Now, what about using second? Entering another person's world and feelings, mentally going into their experience. If you think you can't do this, here's the great thing, guys. This is one of our secret weapons. Pretend you can do it.
Yeah.
Your brain will get it. Pretend you can do it, and it will gradually map over, and you will be doing it.
And then, as we say, pretend you're not
pretending anymore. Whoa. Feel someone else's stress or their happiness. Use it to build rapport with another person. It's a powerful way to get in close with someone as a friend or a loved one and find out what they're going through, to feel it from the inside. And John Grinder taught this amazing way of doing it with micro movements.
Right.
So say you're watching a tennis player and you play tennis. You're watching a video of the person. He said, to take on second position with them, make micro movements. So as they hit the
their
thing,
racket,
you're activating those muscles to like 1,000th of an inch. just watching and doing everything from that perception.
I think I'm assuming
yeah.
a lot of people, I think, naturally do this also when like a good drum beat comes on.
Totally.
You know, you're in your car driving and all of a sudden some like thunderstruck or something, and
for me, it's more the air guitar.
Or
but yeah,
the classic one would be Phil Collins, "In the Air Tonight."
Oh,
everybody, when that drum solo comes on.
Right. We've never discussed this, but you're right. Now,
Every single person in the
There's
world.
another thing here that's important. Don't get stuck in second position. If you're a therapist or a caregiver or a coach, you can be so much in second position, or oncologists, cancer specialists working with patients in second with them, taking on the physiology of people with cancer.
Yeah, you'll feel
seriously
pretty
ill.
depressed. And,
Yes, you will. So you need a lifeline. And a lifeline is shake it off at the end of the day.
Right.
So I would just stand up when I was doing a lot of therapy with people. I'd stand up at the end and I'd say, I'm me again. Shake, breathe, and leave it in the room. Shake off second position. Now, what about fixing relationship problems?
Okay, so
Here's where
this
gets very practical.
We're gonna go a little overtime on this video compared to our original plan because we deliver the goods here. But this is the activity called Perceptual Positions that we encourage you to do. We're only going to explain it. We don't have a diagram or anything.
No, I'll diagram it in the air.
Easy,
It's easy.
yeah.
So imagine you had an argument with, say you had an argument with your significant other. We'll say,
And you disagree on something.
disagree, and it's still tense. And the next day you're bugged and you feel like nothing was accomplished. Here's what you do. Set up 2 kitchen chairs facing each other, about 4 feet apart, doesn't matter. And then give yourself some space so you can look at both the seats from the side. You're just standing there. That's fine. So sit down in the first chair.
That's
Be fully
you.
yourself. How you feel about this argument. And when you feel it, you're associated right away.
Yeah, this is first position.
And imagine you're looking at the person you had the argument with. Imagine them in the other chair. Make it vivid. And feel all the feelings that developed as a result of this conversation or argument. Now, when you've got those feelings strong, take the time to do it properly. It only takes a few seconds. Name what you feel. This will be a single word usually. It might be a couple of words, but it'll be what we call a nominalization. This is a noun that has no physical form. We say you can't put it in the wheelbarrow. So you'll look at this person in your mind, sitting in that chair, you'll feel what you feel, and you'll name it. And this puts a linguistic tag on it in the amygdala in your brain. The name will be something like irritation.
Yeah.
Or misunderstanding.
It could be denial. Or like liar. Who knows? Somebody, depending on the situation, whatever word comes to mind for you is going to be the one that you go with.
Right.
Right.
Now, stand up, sit in the other chair, and imagine you are that other person.
Right.
Their side of the argument discussion, looking back at you sitting in
Take
that
on
first
their
chair.
physiology.
Take it on,
right?
breathe it, feel what they felt, and feel, and look at yourself in the other chair, and name it from this position. And it might be baffled.
Yeah.
Like
take on the attitude, everything of that other person.
Right.
So from their perspective, what would they call it? And now you're in that chair, feeling the way they would feel, naming it the way they would name it.
And now you've got the name for this. Get up and dissociate. Stand, looking back at the 2 chairs, and imagine the 2 of you sitting in these 2 chairs. And watch the relationship take place in the discussion between them. Imagine it's happening again. And now give it a name from this dissociated position. It'll be a different word.
Right.
Now you've got a new word for it.
It might be mismatch. It might be, who knows what.
It could be anything. Now you've got that word. Go back and sit in first position, the first chair again. Imagine you're back in that. And notice how it's changed. There'll be a different word now.
The
You've
key
brought
being,
this
right, with
understanding.
everything that you have learned from rotating through those positions, now sitting back in first position, what has changed? What do you call it now?
And that's it. You may have to go a second round through. The words will be different, but you'll get resolution at this point and you'll understand. It's remarkable. It's so powerful. We do this at every hypnosis training we do in Toronto.
It shifts people.
It shifts people.
And this is the promise that we made up front, is that when you do an activity like this, you're going to gain some perspective from the different perceptual positions. You're going to have a new perspective on what's going on, and that will naturally change how your brain codes things.
Right.
And it will change your behavior. And when your behavior changes, gee, do you think that the other person's behavior might also change?
Right.
Yeah.
Here's a pro tip. We're going to throw this in for you. The way to change someone else's behavior is to change your own behavior. That's the key. You can't change them directly, but by changing yourself, you can change them. So the conclusion is perceptual positions give you this really simple way to consciously make relationship changes and bring in new understandings rapidly, and they will last.
All right. That's it for this video. So if you enjoyed it, then let us know in the comments. Thanks once again, and good night.